Welcome back, everyone, to another deep dive. This time we're exploring something, something that impacts, everyone, but we don't always talk about it openly, vaginal health.
Yeah.
We're going to be dissecting a professional development course for healthcare providers.
Oh, cool.
So it's like getting insider info,
Right.
but breaking it down for everyone, not just the doctors and nurses.
That's a great idea because there's a lot of misunderstanding and, misinformation out there.
Right. So no matter if you're like prepping for a doctor's appointment or just, curious about your own body or maybe want to be a little bit more informed, this deep dive is for you.
It is.
So let's start super basic. When we say vagina, what are we actually talking about anatomically?
Well, you can picture it as a muscular canal about 7 to 10 centimeters long, and it sort of leads from the vulva to the cervix. It's actually a very dynamic environment with an inner lining called the epithelium. And that epithelium is super responsive to hormones, particularly estrogen.
Okay, estrogen. I feel like that's like the hormone that everybody associates with women's health in general.
Yeah, it is.
What does it do specifically for vaginal health?
It's super important for keeping the vaginal lining healthy,
Okay.
nice and thick. And it has these interesting folds in it called rugae.
Okay.
It kind of reminds me of like a landscape with a lot of hills and valleys.
Oh, interesting.
And that actually increases the surface area, which helps the vagina function at its best.
More surface area equals what?
It allows for a better environment for the good bacteria that actually live there.
Ooh.
Yeah. And speaking of good bacteria,
Yeah, let's talk about it.
let's dive into the world of vaginal flora.
It's like a whole little microbiome, right?
Exactly. It's a whole microscopic jungle.
Yeah.
And the star player here is a type of bacteria called lactobacillus.
Okay.
It's like the protective army of your vagina.
Okay.
And its superpower is turning glycogen, which is a type of sugar, into lactic acid.
Hold on, acid. That sounds kind of harsh, right?
I know it sounds a little counterintuitive, but this acidity is actually what keeps the vagina healthy.
Okay.
It's what balances the pH. Which basically means it creates this environment where the good bacteria thrive and the bad guys can't really get a foothold.
So it's like this natural defense system.
Exactly. It's like a built-in bodyguard.
I love it.
And it specifically fights off those pathogens that can cause infections. Things like Gardnerella vaginalis, which is a culprit behind bacterial vaginosis.
Yeah.
And Candida albicans, you might know that better as thrush.
Yeah.
So those are the enemies.
Okay, so we're talking about like good bacteria and bad bacteria and this acidity.
Right.
But how do we actually measure the acidity? Like, what's the sweet spot for a healthy vagina?
That's where pH comes in. And maintaining the right pH is crucial because it directly impacts that balance of bacteria. It's kind of like a seesaw.
Ooh, okay.
When the pH is in that healthy range, which for women of reproductive age is between 3.8 and 4.5,
Okay.
that's when lactobacillus is in control and those other troublemakers are kept at bay.
Okay, cool. But, we go through a lot of changes in life, especially as women. So I'm assuming that this pH doesn't always stay the same, right?
You're exactly right.
Okay.
Vaginal pH mirrors those hormonal shifts that we go through, particularly during puberty and menopause.
Okay, let's break that down. What happens during puberty?
So you remember how estrogen helps keep the vaginal lining healthy?
Uh-huh.
Well, as estrogen levels surge during puberty, the vagina actually becomes more acidic, creating that optimal environment for lactobacillus to flourish.
It's all connected.
It's all beautifully orchestrated.
And what happens when our bodies make less estrogen, like during menopause?
So as estrogen levels decline, that vaginal pH starts to rise.
Okay.
So it becomes less acidic,
Got it.
which can make the environment a little more vulnerable to those opportunistic pathogens.
So pH is basically like a report card almost.
It is. You can think of it as a barometer for vaginal health.
Mm.
It's one of the key things that healthcare providers look at to assess and address potential problems.
Makes sense. Okay, so before we move on to potential problems, let's talk about something that I think a lot of people find maybe a little mysterious or even embarrassing. Vaginal discharge.
Yeah.
It's normal.
It's totally normal, and it's actually incredibly important. It's a sign that your vagina is doing its job, keeping everything clean and balanced.
Okay.
Healthy discharge is usually clear or white, and it might have a mild, slightly musky scent, but nothing strong or offensive.
What is discharge made of?
Well, it's a mixture of things. It's got bacteria in it, It's got shed cells from the vaginal lining,
Okay.
a little bit of mucus, and some fluids.
So it's like a little snapshot of what's going on in there.
It is. It's a glimpse into the vaginal ecosystem.
That's so cool.
Here's a fascinating thing about discharge. It actually changes throughout your menstrual cycle.
Oh, really?
Yeah. So as estrogen levels fluctuate, so does the consistency of the discharge. It can range from thick and sticky when estrogen is low to clear and watery around ovulation when estrogen peaks.
Wow. So our bodies are always giving us clues.
They are. It's all connected to this incredible system that regulates fertility.
Yeah, that's amazing. But of course, like anything in the body, sometimes things can get thrown off balance.
Right.
The course mentioned vaginal dryness as being a common problem, especially during menopause. Why is that?
Yeah, you're right. It's a common concern, and it's often linked to those declining estrogen levels. As estrogen drops, the vaginal walls can thin out, there's less discharge, and the vagina becomes less acidic. And that can lead to that uncomfortable dryness.
And that dryness can really affect a lot more than just physical comfort, right?
Absolutely. It can impact mood, relationships, and even self-confidence.
Okay, so let's talk about what women can do to address vaginal dryness. What are some of the options?
There are actually several effective options. Vaginal moisturizers are a great starting point.
Okay.
They've got these things called bioadhesive polymers.
Okay.
And they essentially act like tiny water magnets. They cling to the vaginal wall and hold on to moisture,
Wow.
mimicking that natural lubrication.
So it's like a long-lasting drink of water.
Exactly.
I love that.
And unlike lubricants, which are more for use during sex, moisturizers can be used regularly.
Makes sense. So how are lubricants different?
Well, lubricants are more your go-to for reducing friction during intimacy.
Okay.
They provide temporary lubrication, and you apply them right before or during sex.
So it's more about like the immediate comfort,
Exactly.
not the long-term hydration.
Yeah. It's important to choose them wisely, though.
Okay.
Because some lubricants can irritate those delicate vaginal tissues.
Got it.
So look for ones that are pH balanced and free of harsh chemicals.
So the course also mentioned vaginal estrogen as a treatment option.
Yes.
What's that all about?
That's a very effective option for women who are experiencing dryness due to low estrogen levels, like what happens during menopause. It comes in a few different forms, creams, gels, and things called pessaries.
Okay.
And it basically delivers estrogen directly to the vaginal tissues where it's needed most.
So it's replacing the estrogen that's naturally declining?
Exactly. And this targeted approach helps to thicken the vaginal walls, increase moisture, and restore that healthy acidic environment.
Sounds promising. Any side effects?
Well, the good news is that vaginal estrogen has very low systemic absorption,
Okay.
meaning it doesn't really enter the bloodstream in large amounts.
Got it.
So that minimizes the risk of side effects sometimes associated with other forms of hormone therapy.
Great. So it sounds like there's a lot of options out there, but of course, always talk to your doctor to figure out the best approach for you.
Right.
Okay, let's switch gears a little bit and talk about bacterial vaginosis, or BV.
Okay.
The course described it as the most common cause of vaginitis. Just how common are we talking?
BV is actually more common than thrush,
Wow.
and it affects a significant percentage of women at some point in their lives.
Okay.
And I think it's really important to understand that while sexual activity can increase the risk, BV itself is not a sexually transmitted infection.
Okay, good to know. So what causes it then?
It happens when that delicate balance of bacteria in the vagina gets disrupted. Remember our friend lactobacillus?
Yes.
Well, with BV, the levels of lactobacillus decrease,
Okay.
and that allows other bacteria like Gardnerella vaginalis to overgrow. And that leads to a shift in the vaginal pH, making it less acidic and more susceptible to these harmful bacteria.
So the bad guys are taking over.
Yeah, they kind of get a leg up.
Okay.
There's a bunch of things that can actually contribute to this imbalance.
Oh, like what?
Smoking,
Okay.
using a copper IUD,
Interesting.
douching,
Okay.
and even certain vaginal washes or deodorants.
Wow. I didn't realize all those things could impact that bacterial balance.
Yeah, it's a delicate system.
It is. Now, what about symptoms? Does BV always cause noticeable problems?
You know what's interesting? About half of women with BV don't experience any symptoms at all.
Really?
Yeah,
So how would you even know?
that's why regular checkups are so important.
Yeah, that makes sense.
But for those who do have symptoms, the most common sign is an unusual discharge.
Unusual in what way?
Typically, it presents as thin, gray, or white,
Okay.
and it often has this distinct fishy smell.
Ooh, that doesn't sound good.
Yeah, it's not the most pleasant.
Yeah. What about itching or discomfort? Are those common with BV?
Not usually. While some women might have a little irritation, itching, and soreness, are usually more characteristic of other conditions like thrush.
So if you are experiencing those symptoms, it's definitely worth getting checked out.
Exactly. It could be something else entirely.
Yeah. Okay. So if someone is diagnosed with BV, what are the treatment options?
The most common treatment is antibiotics,
Okay.
but they can come with a potential downside.
Okay, what's the catch?
Well, antibiotics can clear up the infection,
Mm-hmm.
but they can also wipe out the good bacteria in the vagina.
Ah, so it's kind of a temporary fix that could lead to a long-term problem.
Exactly. It could lead to a higher risk of BV happening again.
Oh, no. So are there other options that can help prevent that?
There are. Thankfully, there are some alternative options that can help restore the vaginal pH and encourage a healthier bacterial balance.
Like what?
The course mentioned acidic gels with bioadhesive polymers. Those can be really helpful.
Okay. Remind me what those are all about.
They're actually quite similar to the vaginal moisturizers we talked about earlier.
Okay.
They work by restoring the vagina's natural acidity,
Mm-hmm.
which makes it less hospitable to those harmful bacteria.
So it's giving the good bacteria a chance to, like, repopulate.
Yeah, exactly.
Yeah.
Level the playing field.
Awesome. And they work.
Yeah. Studies have shown that these gels can be just as effective as antibiotics in treating BV,
Great.
but with the added benefit of a lower risk of it coming back.
That's awesome. So it seems like there are effective ways to address both the vaginal dryness and BV.
There are. And the most important thing is that you don't have to suffer in silence. If you're experiencing any unusual symptoms or you're worried about your vaginal health, just reach out to a healthcare professional.
Yeah, they are there to help you.
They are. They can give you accurate information and guidance to help you feel your best.
Absolutely. It's all about understanding your body and advocating for your own health. It's so important. And I think, a lot of people put off going to the doctor because they're embarrassed or they think it's TMI or whatever. But
Oh, absolutely.
you really hit the nail on the head when you said, these healthcare providers, they've seen and heard it all,
They have.
and they just want to help.
Exactly. They want you to feel comfortable talking about these things.
Yeah. And if you're not ready to talk to a doctor quite yet, or you just want to do a little research on your own,
Mm-hmm.
there are so many good online resources.
There are. Like the NHS website is a good one.
Yeah, or like Planned Parenthood.
Yeah.
There are all these reputable organizations that have evidence-based information.
Exactly.
So you don't have to just like Google it and hope for the best.
Right. And don't forget about product literature too.
Oh, that's a good point.
Like if you're considering a particular treatment option, take the time to read the packaging of the instructions.
Yeah,
It can really help you make an informed choice.
absolutely.
Yeah.
Okay, so as we're wrapping up our deep dive into vaginal health, what are the key takeaways you want our listeners to remember?
I think the most important thing is to remember that a healthy vagina is a remarkable, self-regulating ecosystem.
It really is.
Those lactobacillus bacteria are the real MVPs.
Yeah.
They work tirelessly behind the scenes to keep everything balanced and acidic.
It's amazing what our bodies do without us even knowing it.
I know, it's pretty incredible.
It is.
It's also important to remember that vaginal pH naturally changes throughout life.
Mm-hmm.
It's influenced by hormones and medications and lifestyle choices.
And those changes can sometimes lead to, issues like dryness or BV.
Exactly. But the good news is both of these conditions are common and treatable. There are a variety of options available, from over-the-counter remedies to prescription medications. Understanding how your vagina works and what's normal for you is really the key to staying healthy and feeling your best.
Absolutely. This deep dive has really just highlighted for me how important it is to be proactive about vaginal health.
I agree.
It's not something to be ashamed of.
No,
It's a part of our bodies.
it is. And I think understanding it can be very empowering for women.
Mm-hmm.
It allows you to advocate for yourself and seek appropriate care when you need it.
Exactly. Taking charge of your well-being and not being afraid to speak up.
Absolutely. So to our listener, keep exploring this topic, stay curious about your health, and never hesitate to reach out for support if you need it.
Knowledge is power.
It is.
And when it comes to your body, there's no such thing as TMI.
Exactly.
Until next time, keep diving deep.
See you on the next one. It really is all about, taking ownership of your health and feeling comfortable talking about it.
Yeah, and not just relying on Dr. Google.
Right.
Right. And, I think that leads us to a really important point, which is, even though we've covered a lot of ground in this deep dive,
Mm-hmm.
this is just a starting point.
It is.
And if you're experiencing any kind of, symptoms or concerns,
Yeah,
the best thing you can do is reach out to a healthcare provider.
absolutely.
Someone you trust, someone who can, give you personalized advice and support.
Right. And don't be afraid to ask questions.
Yeah.
advocate for yourself.
Exactly. So I think that's a perfect note to end on. We've
Yeah.
talked about, the anatomy, the physiology, the pH, the good bacteria, the bad bacteria,
Right.
discharge, dryness, BV.
It's all connected.
It is. But I think the biggest takeaway is that, vaginal health is just as important as any other aspect of our health.
It is.
And it deserves our attention and care.
Absolutely.
So to our listeners out there, thank you for joining us on this deep dive.
Yes, thank you.
We hope you learned something new
I hope so.
and that you feel a little bit more empowered to take charge of your vaginal health.
Yeah. You got this.
Until next time, keep diving deep.
See you in the next one.